Hello, I'm Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. Today we're going to talk about emergency cesarean section. Now I have another video on just general information about a cesarean section, but there is an occasion where you might need an emergency C-section. And in that circumstance, you're not really going to have much time to discuss it with your physician. And so I'm going to go over some of the reasons for an emergency C-section and some of the things that'll transpire. And if you have this information, then if you hear those words, we need to go for a C-section now, you'll at least know what's going to happen, okay? So certainly we try to avoid emergency C-sections, but they can be pretty important at keeping you and your baby healthy for emergency scenarios. So what are some of the reasons that you might need an emergency C-section? Well, if the baby's heart rate starts going down and staying down, and that might happen because the cord is getting pinched or it's tight around the neck. Now, just because the cord is around the neck, which I see quite frequently, doesn't mean you're going to need that, but sometimes as the baby gets lower, when you're getting closer to delivery time, it can get significantly low and be such that the baby is in trouble and needs to come out really fast. And if you're not ready to deliver or close to delivery, that's one reason to need an emergency C-section. Another one is something called a cord prolapse. That's where the cord can come out ahead of the baby's head, and then as the baby's head comes down, it can compress the cord, which means the baby is no longer getting any oxygen, and it's not out, so it can't breathe, and that's an emergency situation. Thankfully, it doesn't happen too often. It is a little bit more common if you've had many babies. So someone who's had 3, 4, 5 babies, the baby sits up higher, they can get pretty dilated, like to 5 or 6 before they ruptured. They ruptured and the cord can come down, which is why we encourage women who've even had great success with multiple babies not get lulled into thinking that they don't have a potential for a problem, and that's why we always encourage you to be under good care in a facility that can manage the need for an emergency C-section. You might have something called an abruption, where the placenta separates and starts to bleed. There's a whole nother video on that. That's a reason for an emergency C-section. So I don't need to go into all of the scenarios. Depending on your risk factors, there are others. There are many circumstances where basically the long and short of it is the baby needs to come out faster than you're able to do it in the normal vaginal process, and it can save your baby's life and keep you out of trouble as well, because if, for example, you have an abruption, you could be bleeding significantly. That can be life-threatening to both of you. Okay, so what do we generally do with an emergency C-section? You generally go to sleep. So if you have an epidural, or you generally, when we're not in an emergency, we do an epidural or a spinal, but those don't work fast enough. Maybe a spinal under the right circumstances, but generally it's called a general anesthesia. It means you go to sleep. That means you go back, you go to sleep, you don't know what happens, you wake up, baby's out, you're done. And the time passes in a second for you, even though it doesn't go quite that fast for the C-section. And generally, no one comes back with you because we're dealing with an emergency. We generally have the father stay back. Your physician might have a different opinion on that, but in 3 different states where I've delivered, in California, in North Carolina, and in Indiana, that's what I've seen is the general practice. When we do the procedure, we go faster, so there's a little bit higher chance of infection, so we might extend your antibiotics afterwards. The baby can be, from incision to baby out, can be often under a minute. The fastest I've had is a baby out in 10 seconds. So we go quite fast with your sleep, and then putting you back to bed together is depends on your circumstances, but can take anywhere from 15 minutes to 2 hours. Generally, it's when I do the procedure, it's less than a half hour. That's just an average. That gives you, as the dad, an understanding of how long it would take. We try to get word out, yeah, baby's doing fine, what's going on, to you as the dad who's usually sitting in the room worrying about what's going on. So all surgeries have risks, and the C-section risk is bleeding. And generally, when it's an emergency, there's a higher chance of bleeding. Infection, I said there's a little higher risk of infection, injury to adjacent organs. So all surgeries have a risk of something get cut that wasn't meant to be cut. Means doctors are human, errors occur. Things that can get injured are bowel, bladder, blood vessel, baby, bunch of bees. Other things too. Anything adjacent or nearby. When it's an emergency, can be even a little higher risk. And again, we don't take it lightly. We would rather not do an emergency C-section and not be forced to that. We try to anticipate, but you can't always anticipate every emergency, or the delivery process can change quite quickly. And then that risk, those risks are far less than the risk of not doing the emergency C-section. So generally, when it's an emergency, the alternative is devastating. There's another one. The shoulder gets stuck. The baby can't get out, can't fit. So there are many of those circumstances. I encourage you, if you're concerned about it or if you're at higher risk, to discuss this with your physician. Personally, any patient that I have in labor where I think the chances of an emergency C-section are a little bit higher, then I have this discussion with them about forceps, vacuum, and emergency C-section, because I want them to get any of their questions out, because if I ever suggest that I need to do an emergency C-section, there's really no time to have a discussion or a debate about it. What are some of the things that increase that risk? Well, if you're overdue post dates, so over 41 weeks, if you have meconium, that's where the baby has a bowel movement, and when your water breaks, or when we break the bag of water, if there's meconium, that increases the odds of it happening. If you have an infection, a fever, if you have severe preeclampsia or high blood pressure, pregnancy, or poorly controlled diabetes. These are some of the more common risk factors for it, but it's something to bring up with your physician as it gets closer. Ask the questions, and that way, if it happens, then you'll be able to handle it better, and it will be done pretty quickly. But it's certainly a tense moment for everyone involved, and thankfully the outcomes are generally excellent. Not always. We can't always guarantee perfect outcomes. No one can do that in life, but that's our goal, to do our best to near perfection, but no one ever achieves it perfectly. So I hope the goal here was to try to give you some reassurance, some understanding of what are the things that take place, and what are some of the examples of the reasons why we need to do an emergency C-section, and that will help you better handle it if that turns out to be what you have to go through. Thankfully, overall, it's a very small percentage of deliveries. So please leave your comments. Thank you.